Assalamu alaikum respected doctors. Welcome to my YouTube channel MBBS and BDS lectures. Today's the video number on our YouTube channel is 417. Mean 416 same videos of different subject of MBBS and BDS are present on my YouTube channel. And today our video is related to important Seqs of Anatomy with explanatory answer, which is equally important for both MBBS and BDS student. Now let's start from the first question. Define anatomical position of human body. And second part of this question is what is the median plane? Now if you write in exam SQs in this manner, you will be get higher marks. Now, how we will answer this question? The question is define anatomical position of the body, and the second part is what is the median plane. Now, topic specification is topic is from general anatomy. Now, the key answer is first part of this question answer is what is the anatomical position? The anatomical position of human body is defined as the position of the body in the erect standing posture with the eyes looking forward to the horizon, the upper limb hanging by the sides with the palm of the hands directed forwards, and the feet are together with toes pointing forward. This is the answer of this part of question. Now come to the second part of this question. What is the median plane? Median plane is a vertical plane that divides the right and left sides of the body lengthwise along the midline into externally symmetrical section, mean equal section. This is also called mid-sagittal plane. Mean median plane are also known as mid-sagittal plane. Now come to the second question. What is morula? How blastocyst is formed? Now, this topic is from general embryology. The topic specification is general embryology. Now come to the key answer. The first part of this question is what is morula? Now, how we define morula? Once the zygote has reached the two-cell stage, it undergoes a series of mitotic divisions, increasing the number of cells. After the third cleavage stage, the cells maximize their contact with each other for forming a compact ball of cell, a process known as compaction. Approximately 3 days after fertilization, cell of the compacted embryo divide again to form a 16-cell mulberry-shaped mass called morula. Now we can remember by mulberry shape. In mulberry there is a M, in morula there is a M, and morula mulberry shaped mass which consists of 16 cells. This is the definition of morula. What is morula? This is the short question SQs related to morula. Now second part of question, how blastocyst is formed? Now cyst means cavity. Now blastocyst formation, about the time that morula entered the uterine cavity, fluid began to penetrate through the zona pellucida into the intercellular spaces of the inner cell mass. Gradually, the intercellular spaces become confluent and finally a single cavity, the blastocele, form. At this stage, the embryo is called blastocyst. When a single cavity blastocele forms, at this stage, the embryo is called blastocyst. When embryo enter into the uterine cavity, fluid began to penetrate through the zona pellucida into the intercellular spaces of the inner cell mass. There are two cell mass, inner cell mass and outer cell mass. In inner cell mass, Gradually, the intercellular spaces become confluent and finally a single cavity. The blastocele form. At this stage, this embryo is called a blastocyst. Now come to the third SEQs. What are pharyngeal arches? Enumerate the derivatives of the third pharyngeal arch. Again, this question have two parts. Now the topic specification is special embryology of head and neck. Now come to the key answer. First, what pharyngeal arches? Pharyngeal arches are sausage shaped swelling which appear in the one into half future neck region of the embryo during the 4th and 5th week of the development. Each pharyngeal arch consists of a core of the mesenchymal tissue covered on the outer side by surface ectoderm and the inner side by epithelium of endodermal origin. Mean pharyngeal arches are sausage-shaped swelling which appear in the 1/2 future neck region of the embryo during the 4th and 5th week of development. Each pharyngeal arch consists of core mesenchymal tissue, outer side covered by surface ectoderm, and on the inner side there is a epithelium of endodermal origin, like sandwich. In sandwich there is a below is the endodermal origin epithelium and above is the surface ectoderm. In between there is a mesenchymal tissue. Now come to the second part of the SEQs. Enumerate the derivatives of the third pharyngeal arch. Now derivative of the third pharyngeal arch are three. Number one, greater horn of the hyoid bone. Number two, lower part of the body of the hyoid bone. Third is the stylopharyngeus muscle. Now come to the fourth question. Name the cells found in the loose areolar connective tissue which are second part. What are the distinguishing feature of plasma cells? Now topic specification is topic is from general histology. Now come to the answer, key answer. First, name the cells found in the loose areolar connective tissue. There are 6 types of cell. Number 1, fibroblast. Number 2, histiocyte. Number 3, plasma cell. Number 4, mast cell. Number 5, fat cell. And number 6 is the wandering cells. Now come to the second part. What are the distinguishing features of the plasma cells? There are 4 distinguishing features of the plasma cell. Number 1, large ovoid cell having basophilic cytoplasm due to abundance of rough endoplasmic reticulum. Second distinguishing feature of plasma cell is there is a characteristics unstained area near the nucleus. This region contains the Golgi apparatus and centrioles. The third feature is the nucleus is spherical in shape and eccentric in position. Not in center. Eccentric. Away from center. Number 4, within the nucleus, chromatin occurs as a coarse granules arranged in a regular manner against the nuclear membrane, due to which the nucleus exhibits a cartwheel appearance. These are the 4 distinguishing features of plasma cell. Now come to the 5th question. Name different parts of typical neuron. Give 2 examples of multipolar neuron. Now topic specification is from general histology and the key answer is parts of a typical neuron. There are 2 parts. Number 1, cell body or soma, which contain the nucleus and cytoplasm, which are responsible for forming the neurotransmitter. Second part is the cell processes, which are of 2 types. Number 1, axon, and number 2 is the dendrites. Now dendrites receive the information and axon send the information. Now second part, give 2 examples of multipolar neuron. 2 examples of multipolar neuron are number 1, pyramidal cells of the cerebral cortex. Second is the interior horn cells of the spinal cord. Anterior horn are also known as ventral horn, which have motor neurons. Now, come to the next